Good morning. So, in this part, we are going to discuss about the mechanism of action of anti-anginal drugs. Now, first we'll see about the classification of the anti-anginal drug. So, first under the first classification, that is the nitrates. Nitrates again it can be classified into the short-acting like glycerol trinitrate or GTN, nitroglycerin, and long-acting isosorbide salt. Next is beta blocker like propranolol, metoprolol, atenolol. These are the drugs are used. Next is calcium channel blocker. Calcium channel blocker, different classes of the calcium channel blocker like verapamil, dithiazem, nifedipine. These are we can use in the treatment of the angina. Next, potassium channel opener and others like dipyridamole. These are the drugs we can use. Now coming to the mechanism of action of nitrates. Now, whenever we are talking about the nitrates, these are the drugs, these are the drugs, it will call the release of the nitric oxide, they will call the release of the nitric oxide in the smooth muscle, in the smooth muscle. Smooth muscle means here again the blood vessels and all we are telling that smooth muscle, it will cause the release of nitric oxide. Now, GTP or guanosine triphosphate in presence of you can say that guanyl cyclase, it will convert into the cyclic GMP, cyclic GMP. Now what GTP to cyclic GMP, this particular process it is initiated by the nitric oxide, and nitrates are responsible for the release of the nitric oxide. So in presence of nitric oxide, GTP it will convert into the cyclic GMP in presence of guanyl cyclase. Now this myosin light chain phosphorylated myosin light chain, of course this phosphorylation, for this phosphorylation and all, calcium is one of the agent which is responsible. They will, you can say that bind to the actin and it will produce the contraction. It will produce the contraction. Now what will happen? This myosin light chain, when it will be phosphorylated, it will bind to the actin, it will produce the contraction. Now cyclic GMP, this cyclic GMP, it is responsible for the dephosphorylation of myosin light chain. So cyclic GMP is responsible for the dephosphorylation of myosin light chain, and when there will be the dephosphorylation of the myosin light chain, then it will cause the relaxation. So venodilation, arteriolar dilation, and dilation of the coronary vessels. So when this you can say the dilation will takes place when there will be the dephosphorylation of myosin light chain. And when there will be the venodilation or the arterial dilation or the coronary dilation, what will happen? If there is a dilation, then this you can say that more amount of the blood can flow through the artery, or the coronary blood vessel. More amount of the blood can flow, and if the more amount of the blood flows, so that it will you can say that try to bridge the gap between the oxygen supply and oxygen demand. So that is, you can say that mechanism of action of nitrates. Again here you can find that calcium channels, through the calcium channels, calcium it will come inside the inside the cell, intracellular calcium. Then this calcium it will bind to the calmodulin, and they will form a calcium calmodulin complex. Now this particular complex is responsible for the activation of the myosin LC kinase, light chain kinase, myosin LC kinase activation. And due to this activation, myosin light chain it will be undergo the phosphorylation that is the, already we have told in the previous section, that is the myosin LC phosphate. Now this it will bind to the actin and it will produce the contraction, contraction. So here we can find that what is the important role of the calcium to produce the contraction. Now if there is a contraction, the situation it may be more dangerous, because contraction means blood supply it will be decreasing. Clear? Blood supply it will be decreasing. So calcium channel blocker, whenever we are giving the calcium channel blocker, that means they will useful to reduce the entry of the calcium intracellularly. As a result, it will cause the vasodilation and the contraction it will not there. It will cause the coronary artery dilation, and it may be helpful into the as a anti-anginal drug. Another thing, ATP. ATP, it will form the cyclic AMP. Cyclic AMP, again, cyclic AMP, it is also responsible for the myosin LCA kinase. And this is, we can say that, again, in terms, you can say that it may responsible for the contraction. Another thing, if you remember that whenever we are talking about the beta 2, in the last class only, in the hypertension, beta 2 is responsible for the dilation, blood vessels dilation. So here, whenever we are talking, you can say that beta 2 agonist, how it is agonist, it's not the antagonist. So you can find that they will promote the cyclic AMP, but this phosphate formation it will be not there. And beta 2 agonist, as it is responsible for the dilation of the blood vessels, as we have discussed earlier, also beta 2, but beta 1 again it will produce the contraction, but beta 2 it is produced as a agonist. So these are the things it may be helpful, but again it is not the primary drug we are using in this particular disease condition. As a adjuvant mainly we are doing. Similarly, potassium channel blocker, potassium, say again we have to remember that action potential. Now what will happen when the calcium sodium come inside, it will produce the depolarization, contraction. But when the there is a blockade of the sodium channel or the calcium channel, it will cause the depolarization and hyperpolarization. Similarly, if the potassium channels is open, let potassium channels is open means positive ion potassium which is go outside the cell membrane. As a result, it will cause the hyperpolarization or the dilation. So you can say that like that way, this potassium channels opener, potassium channels opener are also useful as a anti-anginal drug.